Welcome back to the channel, or welcome to it if this is your first time running into us. Today I'm going to talk about semaglutide and hypoglycemia. This is a question we sometimes get around semaglutide because it was originally created for diabetes, and so that's understandable. There is a number of trials that specifically did look at if semaglutide would cause low blood sugar in general. There's a ton of trials. Most of them were in people who have had diabetes, people who are more prone to have issues with low blood sugar. One of the trials called SUSTAIN-6 did look at people who had diabetes and high risk of complications from diabetes. And so they put them on semaglutide versus placebo. Turns out in that trial that there was no increased incidence of hypoglycemia or low blood sugar in those patients that received the medication. Another trial they looked at was called SUSTAIN-4. This was people who had diabetes and were on a medication, metformin, and they may be on another one. And in that trial, we got the same result. There was no increased incidence or risk of low blood sugar in people who were on semaglutide. And yet another trial called SUSTAIN-3, again looking at people who had diabetes and were on metformin and one or two other medications. And in those trials, same thing, people who were on semaglutide did not have an increased risk of developing hypoglycemia. And so after semaglutide was approved, there is a trial from Canada where they observed 815 people for 6 months. And again, same result. There was no increased risk of hypoglycemia in those people as well. So if this is a medication that was created for diabetes, meaning we're trying to lower the blood sugar, why don't we see more hypoglycemia in people? Well, turns out one of the ways semaglutide works is it's going to act like GLP-1 in your body. And what GLP-1 does is respond to essentially a meal. And so it will do a couple of things. One is it's going to increase how much insulin you release in response. Also, the insulin is going to work a little better. So the net effect of that is that our blood sugar is not as high for as long because we're responding more. Now, it turns out when we're not eating, we don't have that response. We don't have more insulin secreted, so we don't have issues with low blood sugar outside of mealtime. I hope you found that helpful. If you want to learn more about other weight loss options or medications, check out one of these videos. We'll see you next time.